आज मेरे साथ एक स्पेशल गेस्ट है एसीटी देसी में, जिनको मैं लेके आया हूँ स्पेशली, एंड he was recently awarded Australian Global Talent Awardee. And before I name him, I just want to share a little bit details about him. So he's a medical entrepreneur and global health leader responsible for establishing the world's first blood clot biobank, and that's in Sydney in Australia. He's among world's top specialists in the field of stroke and cerebrovascular disorders, the founding director and chief investigator at the NSW Brain Clot Bank, which was launched in 2019. And just in 3 years into operation, the bank has already collected hundreds of blood clot samples and is improving the understanding of this disease, which is somehow मैंने उसको नाम दिया है silent killer, but it's understanding of what makes up the clot, where in the body it comes from, and how it is interacting with normal tissue in the brain. Welcome, Dr. Sonu Bhaskar.
Shukriya, thank you, Vikas. It's a pleasure talking to you.
सर, 2 लाइनों में मैंने तो ऐसे आपके लिए बहुत कुछ ऑलरेडी बोल ही दिया है अभी फिलहाल, but if you have to, introduce yourself in short, what would it be in 2 lines?
Thank you, Vikas. मैं एक फिजिशियन साइंटिस्ट हूँ और एकेडमिक न्यूरोलॉजिस्ट हूँ. मैं स्पेशलाइज करता हूँ स्ट्रोक और न्यूरोलॉजी में, और बहुत सौभाग्य है कि मैं एक बहुत बड़ी टीम को लीड करता हूँ जो ऑस्ट्रेलिया में नहीं पूरे विश्व में बहुत जगह पे हमारा इनिशिएटिव्स और इम्पैक्ट होता है. और न्यू साउथ वेल्स ब्रेन क्लॉट बैंक वन ऑफ द प्रोग्राम्स है, और कोविड-19 के दौरान हमने एक इंटरनेशनल टास्क फोर्स भी लीड करी थी जिसका बहुत एविडेंस बेस्ड रिकमेंडेशंस कोविड-19 मैनेजमेंट को लेके हमने रिलीज किया था. तो इन समरी आई एम वेरी पैशनेट अबाउट कि हम कैसे इनइक्वालिटीज़ जो है हेल्थ में उसको रिड्यूस कर सकें, ना सिर्फ ऑस्ट्रेलिया में बस स्पेशली इन लो एंड मिडिल इनकम कंट्रीज़ और अंडर प्रिविलेज्ड पॉपुलेशंस में. एक बचपन से एक हमेशा रहा है कि ब्रेन मुझे बहुत फैसिनेट करता है. उसकी वजह है कि हम अभी भी इस मस्तिष्क के बारे में बहुत कम जानते हैं. बहुत सारी मस्तिष्क की जो डिजीज़ हैं, जो कुरीतियाँ हैं, वो अभी भी उनके ट्रीटमेंट्स हमारे पास अवेलेबल नहीं हैं. लेकिन पिछले कुछ 1-2 दशकों में बहुत काम हुआ है. एक मस्तिष्क के डिसऑर्डर्स को कहते हैं स्ट्रोक.
Right.
जो एज अ स्ट्रोक न्यूरोलॉजिस्ट मैंने बहुत काम किया है इस फील्ड में. तो जब मेरी जर्नी स्टार्ट हुई थी आज से करीब 20-25 साल पहले, 20 साल पहले स्पेन में, तो मुझे मौका मिला उस जगह पे काम करने का जहाँ पे नोबेल लॉरिएट सैंटियागो रैमने कहाल ने काम किया था. Cajal was one of the first Nobel Prize in Medicine in 1906. He was rewarded, bestowed the Nobel Prize for his work in neurosciences. He has always inspired me because he went through extraordinary challenges to prove or disprove things.
Yeah.
And his journey has made a significant impact in my life.
And मेरा एक और इससे ही लिंक क्वेश्चन है about your journey before we move towards more on stroke and important aspects of that. Is you've been to all these universities and beautiful places around the world. You've studied there, you've lived there all your life. What made you come to Australia and settle here? Or is it just not settling right now and you're thinking of moving to another one?
नहीं, मैं बहुत अच्छा सवाल है. मैं हमेशा कहता हूँ कि belonging is not a place per se.
Sure.
Belonging is a corner of safety, which is आप चाहे वो आपके अपने लोग हो. I think people make safety a place of belonging.
Right.
और मैं आज कंसिडर करता हूँ कि मैं ग्लोबल सिटीजन हूँ. जगहों की जो एक बंदिश है वो मुझे मानने की कोशिश होती रहती है, लेकिन मैं कोशिश करता हूँ कि इस बंदिश पे ना बंधूं. अल्टीमेटली हमारा मैं ये सोचता हूँ कि अगर एक पेशेंट है, आप उस पेशेंट को अगर एक चश्मे से देखते हैं कि वो एक बैकग्राउंड से आता है, एक तो हमारी बायसेस उस लेवल पे इम्पैक्ट कर सकती हैं.
Right.
मैं ट्रूली समझता हूँ कि हमें अगर लोगों के अंदर और लोगों के बीच में इम्पैक्ट करना है, हम ये जो बैरियर्स हैं, लिमिटेशंस हैं, बायसेस हैं, इसको अनक्लॉग कर सकें। तो एक जो आपने सवाल पूछा कि वो कौन सी जगह है, तो मैं आज भी वही कोशिश कर रहा हूँ समझने की जगह कौन सी है। शायद अभी भी जवाब नहीं मिल पाया है, अगर मिल जाए तो मैं जरूर बताऊंगा आपको।
Beautiful. I think I got your answer. What can be done still? Like 3-4 things that you think can help democratize use of healthcare services, which is still very far lagging. Of course, in India, other countries, but in Australia as well.
Well, thank you, because I think it's a very important question, and one of the challenges that we have, not just in developing countries but also in developed countries, there is a significant disparity between the socio-economic classes, and that disparity is also consistent across regions. So if you look at India, for example, much of the high-end facilities in terms of medical care are available in big cities, but the small cluster towns or villages, they don't have that access to high-end facilities or the appropriate medical care. And even in Australia, there is a lot of disparities across, not just across the rural and the urban divide that exists, but also within the city. There is a kind of there is an interesting report previously that the outcomes after cancer or after the event of stroke is somehow mediated by your postcode, and
Right.
it's an important indication that the neighborhoods, the socioeconomic neighborhoods that we inhabit, do play an important role, and that's the reason it's important. The democratizing of healthcare means providing appropriate resources to patients, specifically in the neighborhoods where the resources are limited. And by providing appropriate medical services, access to quick and optimal health services, we can provide much more benefit to these populations which carry a disproportionately high burden of these diseases. And that's true about Australia, that's true about India, that's true about most of the countries in the world.
Right. Thank you so much, Dr. Bhaskar. And जो मैं usually करता नहीं हूँ अपने शो में, but इस बार मैं कर रहा हूँ आपके साथ specially because there are certain myths going around about certain things, and people say certain things and they believe certain things. So I would ask you 5 things, and I'll just ask you whether it's a myth or a fact, and if anything you want to elaborate on that. We'll just make it very interactive, right? So first thing that people say, a normal person uses 10% of the brain only. Is that a fact or a myth?
It's a myth because latest studies have shown that more than the 10%, much more broader activity in the brain while performing tasks. So of course this belief has been there for some time, but increasing neurosciences and neuroscientific research has shown that this may not be the fact.
Right. Okay, good. So that's not a fact, that's a myth. The second question is, babies exposed to classical music end up smarter.
I think if this again would be a myth. Unfortunately, there is no compelling evidence to prove this. However, we know that early exposure to music does have some benefit in newborns and so on and so forth. However, the long-term benefits, but also there's no compelling evidence to make a case one way or the other. So I would say at this moment it's still a myth.
Right. So basically आप म्यूजिक अगर सुनाते हैं तो जरूर सुनाइए, because उससे अच्छा टेस्ट डेवलप होगा, जो अच्छी आगे और क्वालिटी ऑफ लाइफ अच्छी होगी, सुनेगा कुछ अच्छा क्रिएटिव होगा. But there's no compelling evidence, as Dr. Bhaskar has said, that it will make the kid very smart. Anyway, the third question is, the brain works better under pressure. myth or fact?
Brain does work, work better in pressure, but this I think it's somewhere in between, because in specific individuals it does work, and there are I think we need to understand that this may not be true for all individuals. However, because of the way we are, from an evolutionary perspective, we kind of mobilize our resources based on the flight mode, which is is the natural instinct to respond. So there is a truth to this, that much of the brain resources gets focused in specific tasks. However, I think we need to be more careful before making more a generalized statement, but there is some truth to this.
Some truth to that, and it's not 100% fact and 100% myth, but it's somewhere in between. Can work for some, cannot work for some. All right, so doctor, second last is, we've heard about a lot of different learning styles. You will learn better with this learning style. You will learn better with this learning style. So people have different learning styles. So the question is that if you do take different learning style, the learning outcome or the learning grasp will be more. Is that a fact or a myth? Or people learn in a similar way?
No, I think individuals learn in different ways, and I think there is truth to this, that there are variabilities in how we learn, and gather information, collect the information, process that information. But of course, there are some basic tenets that underpin that learning and seeking behavior. But people, their experiences of learning and the learning itself varies from individuals to individuals.
Sure. So अगर आप different learning styles expect करते हैं और सोचते हैं कि अगर आपको ये ज़्यादा suit करता है, तो that is right. So you can learn better with certain different learning styles. And the last one is, which is so much talked about. Left brain people are more analytical and methodical, while right brain people are creative or artistic. Before you answer this question, I know that you are both artistic, analytical, creative, as well as methodical. So is that a truth or a fact, or are you using both?
I think unfortunately, this this has been a long-held belief. Unfortunately, the recent neuroscientific studies have shown much more increased, crosstalk between the regions. So left and right brain talks to each other. So having this conjecture that this particular brain is associated with this may not be correct. So I would put this under myth. But at the same time, of course, you can say that the proportion of mobilization and activity in one part of the brain may be a little bit greater than the other part of the brain. But I think eventually the way we respond emotionally or to objective information or to creative information really depends on the crosstalk between the regions in the brain. So for different parts of the neurons to fire together, there are a lot of other variables that play an important role.
So this is not really a fact that a person who can play a piano and can become maestro in piano is not going to be good at mathematics or science.
I think unfortunately that's a myth in particular. But I believe that there is there could be increased mobilization or activity in particular part of the brain. But I think we need to do more. We need to study more to really unravel the intricacies of how we learn and discover. And as I said before at the beginning of the talk, we still know very little about human brain, and our endeavor to understand it should continue.
Great answer, doctor. अब हम स्पेसिफिकली मैंने कुछ 2-4 हफ्ते पहले ब्रेन स्ट्रोक के ऊपर एपिसोड किया था, जिसमें हमने बात की थी एक वॉलंटियर्स के साथ, जिन्होंने बताया था कि उनकी क्या जर्नी रही है, and he is also helping create awareness. But I was also looking for someone who can have more specialist kind of a feedback to this particular disease, which is some kind of, I think still हमको पूरी तरह से पता नहीं है क्या है, क्यों होता है, कैसे होता है। तो कुछ मैं ये सेक्शन में आपके साथ अब रिकॉर्ड करूंगा जिसमें मैं बात करूंगा स्ट्रोक के बारे में, जो मेरी कुछ क्वेरीज है। आपको भी कुछ इसके अलावा जो मुझे शायद नहीं पता आप बताना चाहें तो यू आर मोस्ट वेलकम, बिकॉज दिस इज ऑल अबाउट स्ट्रोक एंड आई वुड लाइक यू टू टॉक in English because I want more and more people to listen to this and understand, so that it goes more than people who just understand Hindi. So it will be better for both of us and everyone if you could just continue this conversational bit in English. Is that okay?
Definitely.
Cool. So sir, मेरा पहला क्वेश्चन जो मैं बोलता हूँ, और मतलब जब मैं स्ट्रोक फाउंडेशन के साथ मैंने लास्ट एपिसोड किया था तो उनके ही वॉलंटियर के साथ किया था, तो मैंने उनसे बोला था कि ये एक साइलेंट किलर है, बट अकॉर्डिंग टू देम दे सेड कि ये जो ब्लड प्रेशर होता है वी कॉल दैट एज साइलेंट किलर, बट टू मी जस्ट लाइक एन एक्रोनिम आई हैव गिवन माई सेल्फ, बिकॉज स्ट्रोक कम्स अनवांटेड, कभी भी आता है, कुछ पता नहीं चलता। क्योंकि मेरे फादर को जब हुआ 2 मिनट्स पहले वो गाना गा रहे थे और 2 मिनट के बाद ही कोलैप्स्ड, एंड देयर वाज नो साइन, ही डिडंट हैव ब्लड प्रेशर, ही वाज नॉट हैविंग एनी ब्लड मेडिकेशन, ब्लड प्रेशर की कोई, बट stroke is a silent killer according to me. And आपको क्या लगता है, in generally people are aware about it, and if not, what can we do to make it a topic of discussion, in more general sense? People कहते हैं अरे मुझे नहीं हो सकता, it can't happen to me, till the time it happens actually, and you say, oh, it happened. So what do you think, are people generally aware about it? What is your experience like?
शुक्रिया विकास। स्ट्रोक एक बहुत मेजर लाइफ थ्रेटनिंग कंडीशन है। जब it's a major life threatening condition when it happens, and it's very unfortunate to those who gets affected because of it. It can cause death and also disability, lifelong disability in people. और stroke one of the leading causes है death की, one of the Australia's third largest killer in this country. It's a major condition which is a huge burden on our society. और इसकी ट्रीटमेंट अब जो है पिछले कुछ दशकों में बहुत सारा काम हुआ. There's a lot of work that has happened in this field, which is now we are able to provide time critical treatments. Now let me explain to you what time critical means in stroke. Unlike many other conditions, in stroke whenever a person experiences stroke, he now has the ability to access treatment. Most of these treatment options revolves around two specific areas, especially in patients who suffer ischemic stroke. Now, before I go to the treatment options, let me explain to the audience what are the different types of stroke. Ischemic stroke is a kind of stroke that is because of the blockage of an artery in the brain. So when there is a particular blockage in the artery, the blood flow supply gets reduced, and then it kind of think about as a fish which stop. When you pull that fish out of the water, the fish starts asphyxiating and eventually dies or suffers. Similarly, our brain, which is always in need of oxygen, when there's a limited supply of oxygen to the brain, then the particular part of the brain tissue starts suffering it because of then it starts dying, and cells and neurons starts dying. And the second aspect, a kind of stroke, is called the hemorrhagic stroke. The hemorrhagic stroke is because when there is a bleeding that happens from that artery into the tissue, and that blood that spills over, that then gets accumulated in the brain, and that causes stroke. So there are two different kinds of stroke. The first kind of stroke, which is ischemic stroke, contributes to about 80% and more of the entire stroke. So it's a major burden, ischemic stroke.
Right.
And then the hemorrhagic stroke, which is about 10 to 20%. So there is so much importance now in this bucket, which is the ischemic stroke, which is the major cause of disability and death in Australia and around the world. Now, in last couple of years, in couple of decades, actually, a lot of work has happened. Now we can provide a treatment to patients with stroke. And the first treatment is called intravenous thrombolysis. It's a treatment where a drug can be administered in a patient, and that drug, which is a thrombolytic drug. It goes to a particular artery in the brain, and then it dissolves the clot. And once the clot gets dissolved, the blood flow gets restored in that brain, and the patient, and we are able to treat stroke. So that's one kind of treatment option. The second kind of treatment option is called endovascular thrombectomy. Thrombectomy in the sense that this is a mechanical procedure by which we are able to pull the clot out of the brain through the use of catheter. So it's, so we can, access that particular artery in the brain and now be able to, pull the clot. So these are two options. However, these treatments are very time critical. So you can always only administer thrombolysis, that TPA, that particular drug, within a short window of time. That's about 4.5 hours from the onset of stroke. So when a person suffers a stroke, then he must access the nearest facility where he can get this treatment, but that has to be within the 4.5 hours. Since 2015, we now have something extraordinary, and that's called endovascular thrombectomy, which can now be given in an extended time window all the way till 16 to 24 hours. So in that extended time window, when the patient, since the time the patient had a stroke, then in that window, if you can bring the patient and patient gets this treatment, then we still can provide extraordinary results to these patients. So as I said, stroke is a major life-threatening condition, and there is so little awareness in our community that many of the patients who experience stroke, sometimes mild or moderate, and unfortunately some severe stroke, don't go on reporting about that incident and don't access services. So it's important that more awareness in this area could be generated.
How do you think that awareness can be created? I mean, we are trying to do our part. You are doing your part. I'm trying to create awareness. But this is like going to very limited audiences who think that stroke cannot happen to me. I'm living a very healthy lifestyle. I'm doing all the good things. I'm doing the right things. But in my personal opinion, I've seen it around the world. People who are fit enough, who are doing all the right things, still have ended up with having some kind of stroke. Is there a kind of a particular profile that gets stroke? Is this age related? Is this is this? I mean, what I'm trying to understand is a kind of a profile which is very susceptible to having a stroke.
So there, of course, we call it the risk factors. There are specific risk factors which predisposes patients to an increased risk of stroke. So these risk factors are smoking, alcohol abuse, so on and so forth. In an unhealthy diet and patterns. So all of these, conditions which we know are the cardiovascular risk factors also have an impact on stroke. And patients who have previous history of one of these conditions are at a higher risk than the general population in terms of having an event of stroke or even heart attack, as you previously know.
Right.
And the awareness has been quite limited because people think that when you're having these risk factors, you're more likely to experience in some quarters of the community that it's about heart attack or heart stroke, what they call it. However, there is the awareness about brain stroke is relatively limited in comparison to the myocardial infarction. And there is so much work, I believe, in both these disciplines to be done. Obviously, a lot of patients don't even, should be encouraged. More patients should be encouraged to access health services, and there is so much work we can do there.
Do you think brain stroke is related to has some kind of relationship with having some kind of ailment with the heart, cardiovascular?
Yes. So patients with previous history of heart disease are at an increasing risk of stroke. So patients who have had a previous heart disease or myocardial infarction or valve replacement or stent surgery or so on and so forth, there is of course an increased risk in those patients to have a stroke. And once we know, if we know about these patients, we can provide much more preventative treatment to these patients, so we can reduce the risk of stroke. But awareness is key in that particular area.
So, like, one of the important thing that I've been thinking, while I'm taking care of my father and my family is taking care of my father. One of the critical thing with stroke is what I feel is there's no timeline attached to it, and that's the lot of anxiety factor that comes with it. Like, for example, if you have a break in your arm, you'll put a cast on. It will be like after physiotherapy, you'll like say 6 months, you'll be almost 100%. You'll be back on your day-to-day things. But with stroke, is there? Do you think there is there now a timeline? Because I've been to many, online internet. There are community groups in which people talk about, survivors talk about their experiences, carers talk about their experiences. Most of the time, it is for some people it might be next week you are all right after a major stroke. For some, it will be like 6 months. For some, it is like still 10 years and they can't move their hand. So what do you have to, what are your views on this, like, factor of there's no timeline attached to this recovery in this disease?
Great question, Vikas. And I think, the stroke recovery, which you're talking about, is quite an individualized, important variable. So every patient is different because you must account for pre-existing risk factors, the event of stroke in particular, the treatment that the patient received, his rehabilitation, so on and so forth. So there are a lot of variables which determine or mediate the outcomes after stroke. And a combination of these factors can dramatically impact your recovery. So that's the reason that some patients can recover within days, some in weeks, and some take even a longer time, even 6 weeks or 6 months, and even more. Or in some cases, patients suffer lifelong disability. So the panorama of the impact of stroke after the event itself is quite varied, and it depends upon, as I said, a number of factors. So that's why providing time-critical treatment, providing the right resources and opportunities for rehabilitation is critical.
Right. So do you think, according to you, do you think a person who has had a stroke can fully recover like 100% from what he was or she was before they had a stroke? Or is there like some kind of partial disability that goes on? You cannot get 100% recovered, like do all the things that you used to do. What are your views on it?
Patient can recover, completely and fully, and there are some individual cases where complete recovery has been achieved, where patient have suffered stroke, have been critically brought to the hospital within a couple of hours. He got the right treatment or she got the right treatment, and there was a dramatic recovery. There are, in some cases it does happen, but as I said before, for that to happen, a combination of factors are important, and the most critical factor there is the access to time-critical treatment, thrombolysis or endovascular thrombectomy. If we can get this extraordinary treatments to these patients timely, we can really impact their outcome and recovery.
Right. And last question, which is my own personal question to you, is there've been talks. People, when I visited all these forums where people were talking about their recovery and stuff, there was some kind of undertones which I could feel, and I read some of the comments and some of the posts there. They said stroke reduces your life expectancy. Is this a fact or a myth?
It is definitely a fact, because some latest studies have shown that stroke does reduce life expectancy. In fact, some Australian studies have also indicated that, and many international studies have indicated that the event of stroke itself is linked with a reduction in life expectancy. However, I believe that with the advent of new treatment options, as we are witnessing, we'll be able to reduce that or expand the life expectancy or the burden of stroke in coming years. However, to achieve that, we need to increase the size of population that can access this time-critical treatment. Unfortunately, a very limited a percentage of patients are able to access this treatment because of number of reasons, not just in Australia, but overseas in India and other places where this treatment in particular villages or towns are not available, and these patients cannot access these time-critical treatments. So just to summarize this particular discussion or this section, I would remind the audience that if they can remember that time is brain. So when stroke happens, time is critical. And as soon as you experience symptoms of a stroke, whether it's facial weakness, drooping of arms, or and when you experience these symptoms, you must access the nearest healthcare facility and try to get the treatment that can dramatically change your life.
Last question about stroke, and that is that what are some of the shortfalls that a person feels? Like, for example, if somebody has a stroke, the anxiety that the next stroke can come anytime can prevent someone from living, the way they used to live. So, for example, if they have to travel, there are limitations. If they can't travel by, say, plane or by car or long distance traveling. So, what are some of the limitations that a person who has probably recovered, say, 60-70%? Are there limitations in terms of flying, in terms of duration of travel, in terms of what they can do, what they cannot do?
It's a good question. Again, it depends on the individual and individual patient management. So, so we really need to look after the cardiovascular risk factors so we can reduce the future event of stroke. And there are a lot of treatment available to prevent a future incident. But of course, the event of a stroke or previous history of stroke increases the risk of a secondary stroke. So, and of course, there in some in categories of patients or in a proportion of patients, we also see an anxiety and patients with anxious about that perception, as you said, but at the same time, I think it's important to do the right thing, access the right services, get the blood test done regularly, access your nearest GP, and make sure that your cardiovascular cardiovascular profile is optimal. And secondly, eating healthy, doing physical activity, reducing and giving up on smoking, and giving up on alcohol, because alcohol abuse is directly associated with the high risk of stroke. So by reducing these conditions and lifestyle, making these lifestyle changes can dramatically impact and also reduce the risk of secondary stroke.
Is it a fact or a myth that certain ethnicities of people, because last time when I did this interaction, there's some kind of research which says people from, say, Southeast Asian countries or African countries, or people from our descent, they have more probability of having a stroke earlier, or as a percentage. Is that a fact or is that a myth?
There is a truth to it, because we know that specific populations do have an increased risk of a stroke, or have a higher predisposition to event of stroke. And we know that the burden of stroke is also increasing in the Southeast Asia specifically, and there is that calls and warrants more attention towards public awareness about stroke and preventative approaches. And of course, stroke impacts vulnerable communities, because we know that in the marginalized communities in the world, a poor cardiovascular profile is quite common, and patients do have limited access to healthcare services. They have limited access to treatment options, and that also bears in mind when you are looking at the risk profile in these patients. So it's important to have that attitude. But generally speaking, I think individuals need to be looked at, depending on their number of individual risk factors, which includes one of the things that you just mentioned, but also lifestyle habits, as well as previous a history of stroke or cardiovascular risk factors.
Thank you, Dr. Bhaskar. And I think there's enough that you have spoken about stroke, and there are a lot of other information that people can get through your website. So I would encourage everyone to do visit your website and have some kind of an understanding, a better understanding of how the stroke happens, and what kind of thing that we can do in the event of stroke. आप सब लोग जो सुन रहे हैं और देख रहे हैं, ये सेक्शन यहीं पे खत्म होता है, लेकिन ये इंटरव्यू अभी खत्म नहीं हुआ, बिकॉज और बहुत सारी इंटरेस्टिंग चीजें हैं जो डॉक्टर सोनू भास्कर के बारे में है, जो हमें नहीं पता है, और हम बात करेंगे आने वाले एक सेगमेंट में. यू लव म्यूजिक, you love languages, you love history, culture, but one thing that I saw distinct in your profile is your addiction to Sephardic music, dreidel, and Jewish folk tales. Why is this fascination? And do you see any similarities between Indian culture and the Jewish culture? And what is it that draws you towards? Because I know that you can speak more than 8 languages, if I'm not wrong. And you are learning a couple of more languages now. So what's this? So just talk me through, and our audiences who are like, with our last question being left-minded and right-minded. And I said, perfect example of you being sitting with, here talking to me and us. And you're a great scientist, you're a great doctor, you can, savor music, you have, history, you like philosophy, you listen to a lot of different music and languages.
No, thank you for that question. I think it's very, interesting and stimulating. I find that, beyond the convention of medicine, mathematics, the so-called, the different objective areas of human knowledge or pursuit of knowledge, there is so much we know, and we don't know. And I think that the gap between what we know and what we don't know sometimes are better addressed in through different forms of expression, such as art and music and philosophy. And I think kudos to my my parents, and I was always quite intrigued, and I read a lot of literature when I was growing up, and I read extensively. I think that has been quite been a passion of mine to understand and know more about cultures and history. And I think that a notion that the culture in India is one particular culture. I think one of the beauties of India has been it's been a melting pot of civilizations.
Sure.
I think one of the only cultures where the Jews who were fleeing wars in different parts of the world found a safe refuge in India. So India was always a melting pot, and that's why you still see a thriving community of different faiths in India. So that's important. The Sephardism has always been very close to my heart, because it deeply kind of tickles that religious humanism, which is a much more deeper conversation and reflection on yourself and how we can make our existence a meaningful existence for our community. And as you have seen and you spoke about before, much of what I do in my work, professional and otherwise, I put community right at the center of it. Whether it's a question that I want to address, whether it's the work that I want to make an impact through. And I think that the exposure to the music and philosophy and art, it also gives me a sense of belonging to what I said before, a sense of belonging of that this is where I feel I can thrive, and I can communicate at a level which gives a sense of safety and purpose, most importantly.
But why Sephardic? Why is the tradition that is what is it that fascinates you? Pulls you towards? Because you said that you're really fascinated with it. I'm just trying to understand. You know, you've been to a lot of places. You've been to Spain as well, so I can understand this like a little bit of from there as well. What is that? What is that thing that draws you towards the
I mean,
Safarism?
there is a personal connection to this as well. And you know, it will take a longer time to talk about this, but I will briefly just say that the Sefardism as a culture has you know, it's a culture which has traveled far east and west. It has traveled and it's been a civilization that has always evolved over time. And I think my increased attention and you know proclivity to this particular form of knowledge has been that much of the time the Sefardism was under persecution in whichever country it was, and there was so you know there was a sense of move from one city to another, being persecuted from one place to another, and still preserving a source of knowledge and humanity despite that that travel is something which makes me, you know, very closer to that thought. Second, I believe this Sefardism is a great assimilation of culture, what we see also in India, that it brought together the African culture, the European values and the Eastern values and the Western values together. And I think that the fusion of different cultures makes it a much more enriched and open for debate and discussion. So that's probably the reason that I'm very, very attached with this.
And what are we without some culture, and what are we without some kind of philosophy in our life? And so much of, you know, the community that we live in, if we can't really connect to that, what are we as human beings? So thank you so much, Dr. Bhaskar, for your time and giving us so valuable information, which will be, you know, useful for people to create awareness around stroke. What can they do, what they cannot do, and what you're doing. So, you know, in the sense of providing information as well as the, you know, medical health practice, democratizing the that was a good tongue twister for me, democratizing the, you know, healthcare services and providing people with quality healthcare, and that's a very good mission. And I would really happy and, you know, would be really keen to work with you if in any sense, if you feel fit, that we can work together and spread this as much as possible within our own community, Indian community, with our extended community in Australia, back in India, anywhere in the world who need the right kind of, because medical, as I feel, it should be the like right to life that we have right to education. We should have right to have, you know, quality healthcare as well, irrespective of our status or our postcode. With that, I'll take your leave, and thank you so much for everyone who's, you know, tuned into this show and listened and watched us. And hopefully you've got some kind of information that will be beneficial for you and your family. And if you can just spread the word, that would be more than appreciated. Thank you so much once again. और जैसे मैं कहता हूँ, अपना शो खत्म करने से पहले, जब तक हम मिलते हैं दोबारा, अपना ख्याल रखिएगा. Stay calm and act desi. Shubh Ratri, Shabba Khair. Good night. Thank you so much, Dr. Bhaskar, once again.
Thank you, Vikas. Well, wonderful talking to you.
Thank you.